Welcome to Module 8, everyone. Today we're diving into cultural and ethical considerations in mental health. It's crucial to understand how deeply culture shapes our views on mental well-being. This understanding is fundamental to providing truly effective and respectful care. We'll explore why embracing diverse perspectives helps us support individuals better and uphold our professional standards. All right, let's dive into our module overview. Today, we're going to explore how culture, ethics, and inclusion profoundly impact mental health understanding, from diagnosis to treatment. We'll unpack how cultural norms shape our views on mental illness, discover ways to reduce bias and stigma, and examine the ethical principles that ensure we provide truly respectful care. Our goal is to equip you with practical approaches for inclusive and equitable mental health services, enhancing your cultural competence for working with everyone. As we cover these objectives, you'll learn to articulate how culture shapes mental health beliefs and behaviors. We'll identify ethical principles for cross-cultural practice, even when they conflict with cultural expectations. Understanding stigma across cultures will help you anticipate barriers to care. Most importantly, you'll develop skills to adapt practices respectfully, ensuring effective and ethical care in our diverse society. This module is structured into 6 key steps. We'll start by understanding how culture shapes mental health, then explore cultural barriers to care. Next, we'll delve into ethical principles across different contexts. We'll also examine intersectionality, how various identities impact mental health. Finally, we'll cover cultural adaptation of interventions and apply everything through practical case studies. This journey will equip you for effective practice with diverse populations. Culture shapes how people experience and express mental health. It impacts what symptoms are recognized, how they're expressed, and what explanations make sense. As practitioners, understanding these cultural influences isn't optional. It's fundamental to accurate assessment and effective treatment. Without this context, we risk misdiagnosis, ineffective care, and alienating those we aim to help. Developing cultural competence requires continuous learning and reflecting on our own assumptions. When we talk about culture, it's far more than just nationality or ethnicity. It's about the shared beliefs, values, and practices that shape how groups understand the world. Crucially, culture is dynamic. It evolves across generations and adapts to new contexts. For us, cultural competence in mental health means 3 things: being aware of our own cultural biases, knowing about different worldviews, and having the skills to work effectively across cultural differences. It's not about memorizing facts, but truly understanding how culture shapes individual experiences. Culture profoundly shapes how mental health is experienced. How distress is expressed can differ greatly. Some cultures focus on emotions, others on physical symptoms. People's beliefs about what causes mental illness, whether spiritual or biological, also vary. This, in turn, influences where they seek help, perhaps from family or religious leaders, not always professionals. Recognizing these diverse cultural lenses is vital to avoid making assumptions about our clients' experiences. Psychological distress manifests differently across cultures. Many non-Western cultures express emotional difficulties through physical symptoms, what we call somatization. For instance, depression might appear as chronic fatigue or headaches, not just sadness. These are culturally meaningful ways of communicating suffering. Western diagnostic systems, however, often prioritize psychological symptoms. This can lead to misunderstandings and inadequate treatment if we don't recognize these diverse presentations. Culture-bound syndromes are conditions recognized within specific cultural contexts that often don't align with standard Western diagnostic manuals. It's important to remember these aren't primitive or invalid. They're meaningful expressions of distress. Take ataque de nervios, for example, a culturally accepted way for Latino individuals to express overwhelming emotional distress. Or consider ghost sickness among some Native American communities, reflecting spiritual explanations. Understanding these syndromes highlights how culture profoundly shapes not just symptom expression, but also how communities respond to mental health challenges. Even when mental health services are available, cultural factors often create big hurdles for people to access and engage with care. These barriers come from many places: individual beliefs, systemic discrimination, and concerns about cultural insensitivity or misunderstanding. Sometimes it's also a conflict between cultural values and Western therapeutic approaches. Understanding these obstacles is crucial for developing more inclusive services. To tackle this, we need both individual cultural understanding and systemic changes to make services truly welcoming and appropriate for everyone. You'll see that stigma around mental illness isn't new, but it shows up differently everywhere. Some cultures see it as a personal failing or even a moral one. Others link symptoms to spiritual causes, like possession. Often, family honor and fear of judgment can stop people from seeking help, especially in cultures where an individual's struggles impact the whole family. These beliefs are deeply rooted and meaningful. Our job is to understand them, recognizing their context, while also finding ways to gently encourage better access to care. Language barriers are more than just translation. Many mental health concepts, like depression, don't have direct equivalents across cultures. Using interpreters adds layers of complexity, concerns about confidentiality, accuracy, and potential biases. Sometimes, family members interpret, which can compromise privacy. Even professional interpreters might lack mental health training. We need careful planning and cultural sensitivity to communicate effectively. It's crucial to acknowledge that many communities have very real historical reasons to distrust healthcare. Unethical research, forced sterilization, and discriminatory treatment have left a lasting impact. Indigenous communities, racial minorities, and marginalized groups often carry collective memories of past abuses, and unfortunately, discrimination still occurs today. As mental health practitioners, we must recognize these harms and actively work to rebuild trust through transparency, cultural humility, and consistent respect for community values. When we talk about ethical mental health practice, it's a dance between universal principles and cultural sensitivity. While values like respect and avoiding harm are universal, how they play out varies. What's considered good or bad can differ greatly across cultures. For example, Western ethics often champion individual autonomy, but many cultures prioritize family decisions. We need to understand these nuances, honor professional standards, and collaborate to find solutions that respect everyone's values. Here we highlight 4 core ethical principles guiding mental health practice. Beneficence means acting in our client's best interests, though well-being can mean different things across cultures. Non-maleficence is about avoiding harm, but what's considered harm also varies culturally. Autonomy respects individual choice, yet in collectivist cultures, family decisions often take precedence. Finally, justice ensures fair treatment. These principles aren't always culturally neutral, reflecting more individualistic values. Our ethical practice means we adapt them to respect diverse worldviews while upholding our professional integrity. Confidentiality and informed consent are complex across cultures. While Western ethics prioritize individual privacy, many cultures expect family involvement in healthcare. For instance, collectivist societies might see withholding information from family as harmful. True informed consent means clients genuinely understand treatment, considering cultural beliefs, language barriers, and health literacy. We must adapt these processes to be culturally responsive, always upholding ethical standards. When we talk about patient rights and safety, things get complex across cultures. What seems like a risk in one culture might be a deeply meaningful practice in another. For example, religious fasting, or even certain family disciplinary methods could be misunderstood. This makes risk assessment and mandated reporting tricky. Our job is to carefully assess each situation, consult with cultural experts, and find solutions that protect safety while truly respecting cultural values. We want to avoid any interventions that cause more harm than good. When we talk about intersectionality, we're acknowledging that people have many interconnected identities, like race, gender, and class. These aren't separate. They combine to shape unique experiences of privilege or marginalization. For mental health, this means understanding how multiple discriminations affect well-being. Our interventions must address these complex realities, not just one aspect of a person's identity. It's about respecting the whole individual. Intersectionality goes beyond just adding up different identities. It's about how these identities interact in complex ways, creating truly unique experiences. Think about it. A working-class Black woman faces challenges different from a middle-class Black woman, or a working-class white woman. These intersections aren't just theory. They deeply impact mental health access, treatment, and outcomes. Grasping this helps us avoid oversimplified assumptions and build more nuanced, personalized care that respects the full spectrum of people's lives. You see how social determinants influence mental well-being across many levels. Individual factors, like biology and personal behaviors, are important, but they're deeply shaped by wider societal forces. Your community and relationships offer vital support, or, sometimes, additional stress. Institutions like education, healthcare, housing, and employment systems either create opportunities or barriers. Ultimately, broad social and economic policies dictate resource distribution and structural inequalities. Ignoring these larger determinants when focusing solely on individual factors can limit the effectiveness of our mental health interventions. Access to mental health care faces many barriers that often combine. Practical issues, like transport or childcare, hit low-income individuals hard. Systemic problems include insurance gaps, provider shortages, and inflexible services. And attitudinal challenges, like provider biases or fear of misunderstanding, deter people. These aren't isolated issues. They intersect, creating huge obstacles for those with multiple marginalized identities. Truly effective care means addressing all these interconnected layers. Cultural adaptation means adjusting our mental health interventions to truly fit different cultural contexts, all while keeping their therapeutic power. It's more than just translating words. It's about deeply understanding cultural values, communication styles, and traditional healing. We need to balance the core intervention elements with flexibility for cultural nuances. This process must be collaborative. Community members are partners, not just recipients. When we get this right, it boosts engagement, lowers dropout rates, and significantly improves treatment outcomes for everyone. It's crucial to distinguish cultural adaptation from cultural appropriation. True adaptation is respectful. It involves collaborating with community members, maintaining therapeutic integrity, and always acknowledging cultural origins. It addresses real community needs and integrates cultural insiders. Appropriation, on the other hand, means taking cultural elements without permission, making superficial changes, and often profiting from them while excluding the originators. The key difference lies in the process, respect, and power dynamics. Ethical practice demands genuine partnership and shared decision-making. When we talk about cultural adaptation, we're really looking at two levels. First, there are surface structure adaptations. These are the visible changes, like using appropriate language, imagery, or adjusting delivery. They make our work more appealing and accessible. But then there are deep structure adaptations. This is where we integrate core cultural values, beliefs, and worldviews. Think about incorporating cultural healing concepts or respecting specific relationship norms. Both are vital, but focusing on those deep structural elements is often what truly enhances effectiveness and improves outcomes by addressing fundamental cultural differences. When we work with interpreters and cultural brokers, specific skills and preparation are essential. Always brief your interpreters on clinical terms and cultural sensitivities before a session. Remember to speak directly to your client, not just the interpreter, using clear, simple language. Cultural brokers bring unique value, offering insights into community norms and helping to resolve cultural conflicts. It's crucial to acknowledge the ethical dilemmas their dual roles can present, especially regarding confidentiality. Always establish clear boundaries. Ideally, both interpreters and brokers should have mental health and ethical training. For successful cultural adaptation, community engagement is absolutely critical. We start by assessing community needs, assets, and cultural context. Then, we build genuine partnerships with leaders and organizations, treating them as equal collaborators. Next, we adapt practices together, always keeping therapeutic integrity intact. Remember, community members should be full partners in both implementation and evaluation. This approach ensures our interventions are truly culturally appropriate, owned by the community, and much more likely to be sustained long-term. We'll dive into case studies that show how cultural and ethical considerations truly intersect in practice. These real-world scenarios highlight the complexities of cross-cultural mental health work and the need for thoughtful, nuanced approaches. Our goal isn't to find one right answer, but to sharpen our skills in cultural assessment, ethical reasoning, and collaborative problem-solving. These cases will help prepare you for the complex decisions you'll face. Here's our first case study. We have a South Asian adolescent whose parents are uncomfortable discussing self-harm directly. They view these topics as inappropriate and potentially harmful, reflecting cultural beliefs about the power of words. However, as practitioners, we have professional responsibilities to assess safety. The parents' desire to be present in sessions also highlights cultural norms around family involvement. So, how do we navigate these competing values? Individual privacy versus family involvement, direct assessment versus cultural sensitivity? Our ethical approach here is all about building trust with the family, while still upholding our professional duties. We acknowledge parents' concerns and cultural values to show respect and explain our obligations regarding safety. Negotiating boundaries often means parents are present for part of sessions, with some individual time for a sensitive assessment. We can use culturally appropriate language to address safety, respecting taboos. Bringing in cultural consultants or community leaders can also help. The goal? Collaborative safety planning that honors both cultural values and professional standards. Here, we have a refugee who refuses psychological treatment, prioritizing practical support like housing and employment. His distrust of authorities is understandable, given concerns about immigration status and mental health diagnoses. We see a tension between immediate practical needs and long-term trauma recovery, different ideas of help. His preference for concrete aid over talking therapy might stem from cultural values around problem solving. The core dilemma: how do we respect autonomy while recognizing untreated trauma could worsen? Here, we outline a culturally responsive approach. Our priority is building trust by first addressing practical needs. Case management is key. It shows we genuinely care about immediate concerns, creating opportunities for deeper connection. We reframe mental health support as skills for managing difficulties, rather than therapy for PTSD. This significantly reduces stigma and increases acceptance. Crucially, we use cultural frameworks to understand distress, respecting their worldview. And transparent documentation addresses immigration worries by clarifying what information is shared. It's about integrating practical and psychological support, not separating them. This case study explores the delicate balance a community center faces when trying to create inclusive wellness programs. They're seeing low participation from LGBTQ+ individuals from conservative backgrounds. The challenge is clear. How do you build genuinely inclusive services without alienating other community members or forcing individuals to choose between their cultural and sexual gender identities? It's about finding that sensitive intersection. Our solution involves engaging different stakeholders separately to understand diverse perspectives, without forcing confrontation. We create multiple entry points, allowing individuals to choose services based on their comfort with identity disclosure. Some programs might be explicitly LGBTQ plus affirming, while others focus on general wellness. Crucially, staff training ensures services are delivered with cultural humility and awareness. This multifaceted approach acknowledges that true inclusion requires intentional effort and varied strategies. To create lasting systemic change, we need intentional advocacy strategies. While individual cultural competence is vital, it alone can't tackle the structural barriers and discrimination impacting mental health. Advocacy means working at many levels, from direct service to policy. It's about understanding power dynamics, building strong coalitions, and truly listening to community voices, ensuring our efforts reflect their priorities, not just our assumptions. To build genuine trust with diverse communities, we need consistent, long-term engagement, not just quick fixes. Show up at community events, even those unrelated to mental health, to demonstrate our genuine interest. Listen actively to their concerns without imposing solutions, acknowledging past harms and validating their experiences. Being transparent about our limitations and mistakes builds credibility. Ultimately, collaborative action means working together on their priorities, not ours. Remember, building trust is slow work, requiring patience and humility. For effective campaigns, we need to move past generic messages and really address specific community concerns and values. Avoid pitfalls like direct translation without cultural context, using stereotypical imagery, or focusing solely on problems instead of community strengths. Effective campaigns involve community members in development, use appropriate channels, and frame mental health in ways that resonate with their values. Acknowledge cultural strengths and traditions while introducing new resources. Success comes from community engagement and behavior change, not just how many people saw the message. Addressing systemic discrimination in mental health requires strong policy interventions. We need regular equity audits to understand how policies affect different cultural groups, using detailed data. Let's make cultural competence training mandatory for all mental health providers, ensuring diverse perspectives are included in policy development. And we must advocate for funding that supports culturally responsive services. These systemic changes are crucial to create an inclusive environment and eliminate discriminatory practices. Here, we see real-world examples of successful cultural adaptation. Zimbabwe's Friendship Bench trains grandmothers for evidence-based talk therapy in familiar community settings, valuing trusted elders over clinics. The DSM-5's Cultural Formulation Interview offers a systematic framework for assessing cultural factors in diagnosis and treatment. These cases highlight how evidence-based practices can be tailored while keeping their integrity, showing the power of community partnership, cultural humility, and creative problem-solving for truly responsive care. So, what are the big takeaways from our discussion? First, remember that culture deeply shapes how we understand and treat mental health. Ethical practice means we must balance universal principles with cultural sensitivity. We also learned that intersectionality is crucial. People have unique experiences based on their multiple identities. True cultural adaptation is about collaboration, not just taking ideas. And finally, individual cultural competence is vital, but we also need systemic change to address bigger inequalities in mental health care. Let's explore some discussion questions that invite us to reflect on our personal and professional experiences with cultural and ethical challenges. Consider how your own cultural background has shaped your understanding of mental health and well-being. Think about any ethical dilemmas you've encountered when working across cultural differences. And let's consider how standard evidence-based practices might need adaptation for specific cultural contexts in our work. Remember, there are no single correct answers here. These questions are designed to promote ongoing self-reflection and learning as we strive for cultural competence and ethical practice. Cultural and ethical competence in mental health practice is an ongoing journey. The principles and strategies discussed provide a foundation, but true competence develops through continued learning, self-reflection, and community engagement. I encourage you to seek opportunities to learn from diverse communities, challenge your assumptions, and advocate for inclusive mental health services. Remember, cultural humility, recognizing what you don't know and staying open to learning is often more valuable than knowledge alone.